This is Rise of Civilization, the continuation of forensic anthropology. And we're going to talk about trauma. And I will warn you, there are graphic photos in this part of the presentation. I do have a slide that comes ahead of time, but I'm forewarning you. So, trauma, of course, is anything that causes damage to bones. It could be gunshots, fractures, occupational stress markers, and we'll talk about that, as well as sharp force injuries. And when you deal with death, you have to have kind of a good sense of humor, let the steam off. So here's some funny things I found online. It's another funny one, depending on your sense of humor. Curiosity killed the cat, and when the time came, Ryan actually found it remarkably easy to cheat death. Okay, so what happened to this person? This is what a gunshot wound to the head would look like. And in the forensic field, we can actually tell entrance versus exit wounds. So here you can see it depends on the size of the hole. It depends on the beveling on the bone, whether it's entrance or exit. Usually, as forensic anthropologists, we kind of know this, but the forensic pathologists would also deal with this type of situation. And this is an interesting case where somebody got shot in the head, but it actually fractured their whole skull. So again, this shows you what's characteristic of an entrance wound. And here comes the graphic photos. So if someone had been shot in the head, you'd see an x-ray like this. And you'd see the pieces of metal in the skull. So this is a case from Washington. This is an individual a head that was found in the trunk of a car. The car was impounded and it went up for auction, and then when they went to sell it, they opened up the trunk and found a head in a bucket. And so whenever you find stuff like that, you have to resect the skull or resect the hair from the skull. And here you can see all kinds of bullet wounds to the head. A lot of times you have to be careful if there are suicides. What's interesting about suicides is that sometimes homicides are made to look like suicides, but a lot of times in actual suicides, the family doesn't want to believe that their loved one committed suicide, so they're always looking at foul play. And for something to be declared a suicide, you have to show some kind of intent, meaning that they left a note, that they were giving their belongings away, that they had a history of depression, suicidal ideation, that type of thing. And this is what it looks like when you have a close range gunshot wound. You actually see the gunpowder burns on the skull. Here you'll see that we can actually tell on bones in an archaeological setting as well as a forensic setting whether or not someone had bones that healed or not. And this is what you're going to see. Again, you're going to see healing on bones if someone had a fracture. I don't know if anybody remembers, but about 10-15 years ago, 2 torsos washed up in Cook Inlet. No head, no arms, no legs. And we knew that they were female because of the shape of the pelvis. And one was easy to identify. Well, not easy, but there was a tattoo. We knew that it was a young female. Looked at the list of missing persons and found that tattoo on a missing person. The other one wasn't as easy. Again, we knew it was a young female, but what we had to do was we actually had to take the flesh off the bones. And then what we found is one of the ribs had been fractured in the past and then healed. So there were only a couple of young females who were missing, we actually went to get their hospital medical records, and sure enough, that's how we were able to identify the second female. As far as I know, to this day, no one ever caught the bad person who did this, and the bodies were definitely dismembered. It's not like they fell in the ocean and animals ate on them. I mean, you could actually tell where somebody had dismembered them by cutting off their limb bones and their head. And so here, now this is from an archaeological setting, but whenever you see cut marks either on flesh in a forensic setting or in an archaeological setting, on arm bones, on hands, what it usually means is defensive wounds. So the person was trying to defend themselves. I threw this in here. There's a company called Bone Clones, and so what they do is they make plastic casts of interesting looking skulls, and this one was very large. It came from a gladiator cemetery in Rome. As you can see here, it says, due to his extraordinary size, it was inferred that men were picked for size, if not bred to be very large. And he had very dense bones, some signs of trauma, which would make sense if he was a gladiator. Okay, here's some more. These are very graphic photos, so if you don't want to see them, I would end this part of the presentation. This is what someone looks like when they're in a fire. And this is another one. This is from the state of Oregon. And basically, when the police see individuals like this, they'll say, okay, usually the person's fists are clenched, and they look like almost like they were fighting. That's called a pugilistic pose. You see this in burn victims, mainly because as you burn, all the muscles in your body contract. A pugilist, that's the word for fighter, so that's why we call it that. Now, in all burn cases, what would happen is that the body is x-rayed. Why is the body x-rayed? Because you're going to look for bullets. How the person died. The other thing that you're going to look for is the doctor would cut open the trachea to look for soot. Why do they look for soot? Well, if the person was alive during the fire, they were breathing, and they were breathing in the smoke. If they were already dead when the fire started, you wouldn't see the soot. This is what happens in plane crashes. What you're looking at is the person's head to the left, torso, and unfortunately, most plane crashes are pretty ugly. We're talking body parts, a lot of burning. In a lot of cases, the only thing that stays intact are the teeth. Not all the time, but a lot of times. And that's, I guess, the only good thing about plane crashes is that, be it a small plane or a large plane, you always know who was in it, usually. There's a manifest in small planes. You can never assume that the person, if they are still in the plane, that they were the pilot, but we're always going to get dental records. In large plane crashes, not only are you going to get dental records, but you're going to talk to the family, we're going to talk about other identifying characteristics, but it's really not pretty. Okay, and these are the things we're going to look for. So forensic odontology is forensic dentistry. Now, the problem with it is, we had a case in Anchorage where a person committed suicide. They were found in the woods the following spring. The person was totally skeletonized underneath the clothing. He was still holding the gun, but he blew his head off. So the problem was we didn't have any teeth. And even if we did, the only way you can use forensic dentistry, right, is if you have an idea who the person is. If you have no idea who the person is, then you can't get dental records for every single person that ever lived. What we talk about is markers for occupational stress. We mean, was the person an athlete? Were they a longshoreman? They might have more instances of arthritis. Did they wear dentures? Did they have a hip replacement? Did they have their jaws wired shut? And then antemortem injuries or illnesses. that means before death. So again, what kind of things did they have? So here's forensic dentistry again. Here's the stressors. So this is what arthritis looks like on bone. Here again is dentures. I did a study on all the type of prosthetic devices. You'd be surprised. Hip replacements sometimes could be confused as trailer hitches. Again, if they're out of context, you might just think it's part of a plane or whatever the person was in. Here's some wiring again that might help identify someone.